State of the Union is what I still believe. If you can show me, and if I get confirmation from healthcare experts, people who know the system and how it works, including doctors and nurses, ways of reducing people's premiums, covering those who do not have insurance, making it more affordable for small businesses, having insurance reforms that ensure people have insurance even when they've got pre-existing conditions, that their coverage is not dropped just because they're sick, that young people right out of college or as they're entering into the workforce can still get health insurance. If those component parts are things that you care about and want to do, I'm game. And I've got I've got a lot of these ideas. The last thing I will say, though, let me say this about healthcare and the healthcare debate, because I think it also bears on a whole lot of other issues. If you look at the package that we've presented, and there's some stray cats and dogs that got in there that we were eliminating. We were in the process of eliminating. For example, we said from the start that it was going to be important for us to be consistent in saying to people, if you can have if you want to keep the health insurance you got, you can keep it. That you're not going to have anybody getting in between you and your doctor in your decision making. And I think that some of the provisions that got snuck in might have violated that pledge. And so we're in the process of scrubbing this and making sure that it's tight. But at its core, if you look at the basic proposal that we put forward, that has an exchange so that businesses and the self-employed can buy into a pool and can get bargaining power the same way big companies do, the insurance reforms that I've already discussed, making sure that there's choice and competition for those who don't have health insurance. The component parts of this thing are pretty similar to what Howard Baker, Bob Dole, and Tom Daschle proposed at the beginning of this debate last year. Now, you may not agree with Bob Dole and Howard Baker, and certainly you don't agree with Tom Daschle on much, but that's not a radical bunch. But if you were to listen to the debate, and frankly how some of you went after this bill, you'd think that this thing was some Bolshevik plot. No, I mean that's how you guys presented it. And so I'm thinking to myself, well, how is it that a plan that is pretty centrist? No, look, I mean, I'm just saying, I know you guys disagree, but if you look at the facts of this bill, most independent observers would say this is actually what many Republicans, it is similar to what many Republicans posed to Bill Clinton when he was doing his debate on health care. So all I'm saying is we've got to close the gap a little bit between the rhetoric and the reality. I'm not suggesting that we're going to agree on everything, whether it's on health care or energy or what have you. But if the way these issues are being presented by the Republicans is that this is some wild-eyed plot to impose huge government in every aspect of our lives, what happens is you guys then don't have a lot of room to negotiate with me.